Why is it my preference to do a BBL awake under tumescent anesthesia? I'm Dr. Victoria May. I'm a plastic surgeon in Scottsdale, Arizona. I do a lot of body contouring, breast surgery, things like that. A lot of my procedures involving liposuction, body contouring, and fat transfer I do on patients awake in my office using something called tumescent anesthesia. So basically that's using a fluid that contains saline, epinephrine, and lidocaine to help keep you nice and numb and comfortable. When it comes to BBL, there is a big concern about the dangers of BBLs. It really comes from something called a fat embolism. So when we inject fat into the buttocks, if it goes into one of the big blood vessels that go through the muscles in the buttocks, then it can actually travel up to your lungs and people can die from that. The area above the muscle where we have fat, so if this is skin and our fat layer and our muscle, that layer in between that we're going to put the fat into is completely numb with the tumescent anesthesia, but the muscle's not. So if for any reason I inject into the muscle, the patient will tell me. So for that reason, to protect patients and keep them safe, I will only inject above that muscle in the fat layer. So there's two layers. In the fat layer, there's a more superficial layer that's closer to the skin, layer that absorbs fat better or takes fat better that's a little deeper. But still above the muscle, so it's still a safe plane. I do a lot of my BBLs awake in the office using tumescent liposuction. Patients do very well with that, but it can also be done asleep if a patient prefers. It's really up to you. But I am not a surgeon that will inject fat into the muscle because I just think it's too dangerous for patients. If you have any questions, feel free to drop them below.